Welcome to today's webinar on the topic of Medicare Getting Started, a Centers for Medicare and Medicaid Services ITU training webinar. My name is Amanda Ree Fox, and I am from Kaufman & Associates, and I will be your moderator today. Today's webinar is Medicare 101 Getting Started. I also want to point out that this webinar is part of the ITU training webinar series. Please join us for the remaining webinars in the series. The next webinar is scheduled on May 15th at 2 p.m. Eastern Time. With those announcements made, I will now turn it over to Mary Munoz to introduce today's topic. Mary?
Good afternoon or good morning to those on the West Coast. This is Mary Munoz. I got a little excited there. I am a health insurance specialist and a Native American contact out of the Centers for Medicare and Medicaid Services, Region 8 in Denver. And I work in the Drug and Health Plan Operations branch. However, in my role as the NAC, I also facilitate questions related to billing and enrollment with our appropriate Medicare contractors for Indian Health Service, tribal clinics, and urban facilities. So please use me as a resource for any of those questions. I'm not a Medicare billing or provider enrollment expert, but I am able generally to get those questions to the appropriate contractor. So let's start. Let's move 2 slides into what is Medicare, and we'll get started. So Medicare, what is Medicare? I'm sure most of you have a general sense of what Medicare is. Medicare currently provides health insurance for 59.7 million United States citizens. It's a health insurance for generally 3 groups of people. Those that are age 65 and older. Medicare is also for people under age 65 with certain disabilities who have been entitled to Social Security disability insurance benefits for 24 months. In the 25th month of eligibility for those that are disabled, you become enrolled into Medicare. This includes those that are diagnosed with ALS or Lou Gehrig's disease. However, with that diagnosis, there is no waiting period. Medicare is also for people of any age who have end-stage renal disease or the further defined as those with permanent kidney failure requiring dialysis or a kidney transplant. Next page. What agencies are responsible for Medicare? Social Security is responsible for enrolling those people into Medicare, and the Railroad Retirement Board is responsible for enrolling railroad retirees into Medicare. Social Security and Railroad collect premiums and determine the amounts of the Part A if you have to buy it, and Part B premiums. If you are retired from federal service, we suggest that you contact the Office of Personnel Management regarding your Medicare premiums, as they can assist with handling your Medicare deductions from your retirement benefit. And of course, CMS handles the Medicare coverage, benefits, and payments from our agency. Next slide. What are the parts of Medicare? The parts of Medicare include Part A, also called hospital insurance, which helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, home health care, blood. Part B of Medicare, also called medical insurance, helps cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs and walkers, and many preventive services like screenings, shots, and yearly wellness visits. Part D of Medicare is your prescription drug coverage, which helps lower cost of prescription drugs. Part D plans are administered by private health insurance companies approved by CMS. Next slide. Medicare coverage options. When you first enroll in Medicare, you can choose how to get your Medicare coverage and benefits. Medicare covers many types of services, and the options, or the two main ways to get Medicare, is through Original Medicare or through a Medicare Advantage plan, also known as Part C. With Original Medicare, you can choose to enroll in a Medicare supplemental insurance policy or Medigap plan, and these policies only work with Original Medicare, which we'll talk about more specifically in a little bit. Next slide, please. Original Medicare includes Medicare Part A and Part B. If you want Part D or the prescription drug coverage, you can join a plan separately. Again, you can buy a Medigap supplemental policy to supplement your coverage with Original Medicare. Next slide. And again, the second option besides Original Medicare on how you may choose to receive your Medicare benefits is by joining a Medicare Advantage or MA plan. MA plans are an all-in-one alternative to Original Medicare, usually a bundled plan which includes Part A, Part B, and usually Part D. Some MA plans may have lower out-of-pocket costs than Original Medicare, and some plans offer extra benefits that Original Medicare doesn't cover, like vision, hearing, and dental. Next slide. Let's talk about enrolling into Medicare. When is Medicare enrollment automatic? If you're already getting Social Security or railroad benefits, you'll be automatically enrolled in Medicare Part A and Part B without an additional application. You'll get your initial enrollment period package, or IEP package, which will include your Medicare card and other information about 3 months before you turn age 65 or 3 months before your 25th month of disability benefits. If you are not getting retirement benefits from Social Security or Railroad, you must sign up to get Medicare. Next slide. Again, if you're not getting Social Security or Railroad benefits at least 4 months before you turn 65, for instance, because you're still working, you'll need to sign up for Part A and Part B. To avoid a delay in coverage, you should contact Social Security to apply for Medicare 3 months before you turn 65. If you work for a railroad, again, contact Railroad to apply. And important to note is that you don't have to be retired to get Medicare. You can enroll online at socialsecurity.gov. You can call their 1-800 number or make an appointment at your local Social Security office to apply for Medicare. Next slide. If you don't have Medicare and you're eligible for premium-free Part A, meaning you have the appropriate work history to qualify for free Part A, you can enroll in Part A anytime you're eligible. Your coverage can begin up to 6 months retroactive from the month you apply, and that would be, for instance, if you continued to work for a year and you went in to apply beyond your IEP. If you enroll, however, you can enroll in Part B only during specific enrollment periods. Your first opportunity to enroll is during your initial enrollment period or IEP. If you don't enroll in Part B during the IEP, which we'll talk about in the next slide, you'll have to wait until the next general enrollment period or GEP. Enrolling in Medicare or changing how you get your Medicare are important decisions. They must be done timely to avoid an LEP and to be sure you get the coverage you need when you need it. Let's talk about some of these enrollment periods, IEP and GEP. Next slide. This slide represents your initial enrollment into Medicare. You can sign up for Medicare A and B during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65 and ends 3 months after the month you turn 65. If you sign up for coverage during the first 3 months of your IEP, as this slide indicates, in most cases your coverage starts the first day of your birthday month. If you delay enrolling during the IEP, your coverage could be delayed, as the slide indicates. So that's why we recommend, applying during the first 3 months of your IEP so that your coverage starts the month of your 65th birthday. When you apply during the IEP, your 6-month Medigap open enrollment period starts when you're both 65 and have Part B, which we will also talk about in a little bit more detail here shortly. Next slide. So what happens if you don't sign up for Part A or B during your IEP? You can then enroll only during a GEP or a general enrollment period. The GEP occurs each year. It begins January 1st and ends March 31st. If you enroll in the GEP, your coverage will start on July 1st of that same year. In addition, if more than 12 months have passed since you turned 65, you'll likely have to pay a lifetime late enrollment penalty that's added to your monthly Part B premium. However, if you delayed Part B because you or your spouse are still working and have group health plan coverage, you won't pay a late enrollment penalty and may be able to enroll during a special enrollment period or SEP. Next slide. The SEP applies if you or your spouse are still working and you didn't sign up for Part B during your IEP. You may be able to enroll under the SEP. Importantly, if you're age 65 or older, the group health plan coverage through either yourself or your spouse has to be based on current employment. So you have to be considered an active employee. Also important to note is that COBRA, retiree coverage, long-term workers' comp, and VA coverage aren't considered to be from active current employment, so wouldn't qualify for an SEP. During an SEP, you can sign up for Part A and or Part B anytime you are still covered under the group health plan, or during the 8-month period that begins the month after employment ends or the coverage ends, whichever happens first. You can buy a Medigap policy during the 6 months after your Part B effective date. If you qualify for an SEP and don't use it, again, you'll have to wait for the next GEP to enroll. You'll have a gap in coverage and may have to pay a penalty. This SEP does not apply to people who are eligible for Medicare based on ESRD, and also doesn't apply if you're still in your IEP. Next slide, please. I will now talk a bit about Medicare Part A and B coverage and cost. Next slide, please. And this is for original Medicare Part A. Part A helps cover medically necessary inpatient services. Part A coverage includes inpatient hospital care. There is criteria for inpatient hospital care covered under Part B that includes, one, a doctor makes an official order which says you need 2 or more midnights of medically necessary care to treat your illness or injury. 2, that you need the kind of care that can only be given in a hospital. 3, of course, the hospital accepts Medicare. And then 4, the Utilization Review Committee of the hospital approves your stay while you're there. Medicare Part A also covers inpatient skilled nursing facility care. This is not custodial or long-term care. Skilled care includes registered nurses, licensed practical and vocational nurses, PT and OT, speech language pathologists, and audiologists. You must first have a related 3-day inpatient hospital stay, not including the day you're discharged as part of the criteria for the SNF care. Next slide, please. This slide represents more covered services under Part A. Blood, inpatient care in a religious non-medical health care institution, home health care, and hospice care. What is not covered under Medicare Part A is private duty nursing, private rooms, TV and phone in your room, and personal care items. Next slide, please. So paying for Medicare Part A, you usually don't pay a monthly premium for Part A coverage if you or your spouse paid enough Medicare taxes while working. This is called premium-free Part A. FICA tax is a federal payroll or employment tax imposed on both employees and employers to fund Social Security and Medicare. And as we know, as we're looking at our payroll documents, you can see the Social Security and Medicare taxes that come out. About 99% of people with Medicare don't pay a Part A premium since they've worked at least 40 quarters, the equivalent of 10 years of Medicare-covered employment. Enrollees 65 and older and certain persons with disability who have fewer than 40 quarters of coverage pay a monthly premium to get the coverage under Part A, unless they can get benefits or qualify for benefits through a spouse or family member's Social Security earnings record. Next slide, please. So for this year, what you pay in original Medicare for Part A services, for an inpatient hospital stay, I won't go through each one, but there is a $1,408 deductible for days 1 through 60, and then the coverage for additional days below that for skilled nursing care. 0 out-of-pocket costs for the first 20 days, $176 per day for day 21 through 100, and then any days after 100 are the Medicare members' responsibility to pay. For home health care services under Part A, there's 0 coinsurances for the services. However, 20% of Medicare's approved amount for durable medical equipment is responsible for the Medicare beneficiary. For hospice care, nothing except for up to $5 per prescription to manage pain and symptoms. And then should the patient or family need it, there's a 5% co-insurance amount for inpatient respite care. And also blood. If the hospital gets it from a blood bank at no charge, then there's no charge to the member. Next slide, please. So coverage under Medicare Part B includes medically necessary doctor services, outpatient medical and surgical services and supplies, clinical lab services, including blood tests and some screening tests, durable medical equipment again, diabetic testing equipment and supplies, preventive services, home health services, medically necessary outpatient PT and OT therapy, and speech language services, and also outpatient mental health care services. Next slide, please. So what you pay for Medicare Part B services, well, before I get to that, what you pay for Medicare Part B premium. You pay a Part B premium each month. The standard Part B premium amount in 2020 is $144.60 per month. And you will pay that amount if you enroll in Part B for the first time in 2020. If you're not getting Social Security benefits and are direct billed, you will pay the $144.60. However, if you have Medicare and Medicaid, Medicaid will pay that premium, and they will pay that standard $144.60 this year. If you have a modified adjusted gross income as reported on your IRS tax return from 2 years ago, above a certain amount, you will pay the standard premium amount and an income-related monthly adjustment amount, or IRMA, which is an extra charge added to your premium based on a high income as reported to Social Security by the IRS. Next slide, please. So what do you pay for Part B services under Original Medicare this year? In addition to the premium, there are other costs. What you will pay for Part B covered medically necessary service is an annual Part B deductible, which is $198 in 2020. This is an amount a person must pay for health care each calendar year before Medicare begins to pay. This amount can change every year. And then after meeting that annual deductible, you pay a co-insurance for Part B services. In general, it's 20% for most Medicare covered services. Next slide, please. I just wanted to point out a few situations in which you must have Medicare Part B when you're considering enrollment. You must have Part B if you want to buy a Medicare supplemental insurance or Medigap policy. If you want to join a Medicare Advantage plan, you must have Part A and Part B as well. You must have Part B if you're eligible for TRICARE, CHAMP VA, or CHAMP VA benefits. And you must have Medicare Part B if your employer coverage requires you or your spouse or family member to have it, which is generally those employers with fewer than 20 employees. As far as VA benefits, just wanted to note that they are separate from Medicare. With VA benefits, you may choose not to enroll in Part B, but you could pay a penalty if you don't sign up for Part B during your IEP and enroll later. Those with VA benefits are not eligible for an SEP because that coverage is not based on active employment. Next slide, please. What isn't covered by Part A and Part B? Medicare does not cover everything. Here is a list of some services not covered under Part A or Part B, which I won't read to you. These services may, however, be covered if you have other coverage, including Medicaid to cover the cost, or if you're in a Medicare Advantage plan that covers these services. Next slide, please. So let's talk about Medicare supplemental insurance policies or Medigap plans. This is a supplemental insurance sold by private insurance companies to fill the gaps in original Medicare, those out-of-pocket and co-insurance amounts we just talked about. Some policies cover certain benefits original Medicare doesn't cover, like medical care if you travel outside the United States. They do not cover shares of costs under under Medicare managed care plans, under Medicare prescription drug plans, group health plan insurance, Medicaid, VA, or TRICARE. In all states except Massachusetts, Minnesota, and Wisconsin, Medigap policies must be one of the standardized plans, A through N. They're lettered so they can be easily compared. Each plan has a set of benefits that are the same for any insurance company. It's important to compare the policies because costs can vary. Each company decides which Medigap policies it will sell and the price for each plan with state review and approval. Next slide, please. Again, all policies have to cover a basic set of benefits as reflected on this chart. For instance, if you're looking at the chart, all plans pay 100%, A through N. All plans pay 100% of Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. All plans also pay the Part B coinsurance or copayment amounts. All plans pay for blood and Part A hospice coinsurance amounts. And you can just look at this chart and determine for yourself what they cover. Because of the various coverages among the Medigap plans, it's important to determine your needs and cover options when selecting a plan. Next slide, please. When is the best time to buy a Medigap policy? Usually the best time is during your Medigap open enrollment period, which begins when you're 65 or older and enrolled in Part B for the first time. You must also have Medicare Part A to have a policy, and you have a 6-month open enrollment period, which gives you a guaranteed right to buy a Medigap policy. Once this period starts, it can't be delayed or repeated. During this open enrollment period, companies cannot refuse to sell you a policy that they offer, make you wait, or charge more as far as a premium because of past or present health problems. However, you can also buy a Medigap policy beyond the OEP whenever a company agrees to sell you one. However, there may be restrictions like medical underwriting or a waiting period for pre-existing conditions. Next slide, please. How would you buy a Medigap policy? First, you need to decide which plan has the benefits you need. Next, find out which insurance companies sell the Medigap policies in your state. You can contact the State Health Insurance Assistant Program, or SHIP, or contact your state insurance department to check on companies selling plans in your area. Medigap protections aren't offered for people with Medicare due to a disability. However, some states do offer Medigap policies for those that are disabled. You'll just want to check with your state insurance department to determine if your state offers those. You should call the insurance companies and shop around for the best plan at the price you can afford, and then buy the Medigap policy, making sure that the insurance company gives you a clearly worded summary of your policy once you apply. Next slide, please. Let's talk about Medicare prescription drug coverage. This is an optional benefit available to all people with Medicare. If you choose original Medicare, you want prescription drug coverage, you must choose and join a Medicare Part D plan generally. There are instances where you're automatically enrolled in one, which I'll talk about. You usually pay a monthly premium. Again, these plans are run by private companies that contract with CMS. Part D coverage is provided through Medicare. We call them standalone prescription drug plans, and you can also receive Part D coverage through a Medicare Advantage plan, and we call those MAPDs. Next slide, please. Medicare drug plan costs, what you will pay in 2020. Costs vary by plans. Most people will pay a monthly premium, which varies by plan and your own income. A yearly deductible, if applicable. Co-payments or co-insurance amounts, percentage of cost while in the coverage gap. However, very little spending after $6,350 out of pocket in 2020, which automatically provides catastrophic coverage. Next slide, please. How does Medicare Part D work? Everyone with Medicare can get a Part D plan by enrolling in one. You may pay a penalty if you join later. You can also get, again, coverage, Part D coverage through an MA plan. Each plan has a formula or list of covered drugs. The formula for each plan must include range of drugs in the most commonly prescribed categories. All Medicare drug plans generally must cover at least 2 drugs in each category, but plans can choose which specific drugs are covered in each category. There are 6 protected categories to treat certain conditions plans must cover, and those include cancer, HIV/AIDS, drugs, antidepressants, antipsychotics, anticonvulsants, and immunosuppressant drugs. Formularies are subject to change and can be changed by the plan, and your plan should notify you of any formulary changes that affect drugs you are taking. People with limited income and resources may be able to get extra help paying their Medicare drug costs, and we will discuss extra help here in a little bit. Okay, next slide, please. Who can join a Part D plan? Again, you must have Medicare Part A and or Part B. You don't have to have both unless you want to enroll in a Medicare Advantage plan that includes prescription drugs. Each plan has its own service area, which you must live in to enroll. If you are incarcerated, you're not eligible to enroll in a plan. You must also be lawfully present in the U.S. to be eligible to enroll in a plan. Most people must join a plan, and I'll talk about when you're automatically enrolled. So while all people with Medicare can have this coverage, usually you have to take action to get it. If you qualify for extra help to pay for your prescription drugs, Medicare will enroll you in a Medicare drug plan unless you decline coverage or join a plan yourself. You can only be a member of one Medicare drug plan at a time, of course. Next slide. The Part D late enrollment penalty. If you choose not to join a Medicare drug plan at your first opportunity, you may have to pay a late enrollment penalty, or LEP, in addition to your regular monthly premium if you choose to enroll later. If you had other creditable coverage, or if you qualify for extra help, you won't have to pay an LEP. Medicare calculates the LEP as described on this slide. If you are assessed an LEP, your plan is required to tell you if you owe a penalty and what your payment will be. If you don't agree with the LEP, you can ask Medicare for a review or reconsideration, and you'll need to fill out a form where you'll have the chance to provide proof that supports your case. However, most important to note as for Part D is that Indian Health Service is considered creditable coverage, and you should not have any patients or family members paying an LEP. If you're aware of someone that might be paying an LEP in error, please let me know. Next slide, please. So what should you consider? Well, one of Part D cost considerations when looking for a plan is to look at the formulary or list of covered drugs. You'll want to check that your prescriptions are covered and compare the amount you'll pay. You could have lower out-of-pocket costs if you have access to and use a preferred pharmacy. You may pay a late enrollment penalty if you join later, so you want to consider that when you're enrolling into Medicare and considering your coverage, your costs. Costs can vary depending on the plan. Some plans might offer more coverage and additional drugs, generally for a higher monthly premium. If you have limited income and resources, you may qualify for extra help to pay for your Medicare prescription drug coverage. Again, we'll talk about that here in a second. Next slide, please. When can you enroll into a Medicare Part D plan? Of course, during your initial enrollment period into Medicare. There's also an annual election or open enrollment period, which is October 15th through December 7th of each year. Any eligible person can join, switch, or drop a Medicare drug plan at this time. In addition to having a chance to make changes to your for Medicare prescription drug plan for the following year. Enrollment or changes during this open enrollment period has coverage starting January 1st of the following year. Generally, you must stay enrolled for the entire calendar year. However, in certain circumstances, you may join at other times. Like if you switch from a managed care plan back to original Medicare or during the MAOEP, you may add Part D coverage. The MAOEP is different in that it's January 1st through March 31st of each year, with, of course, the coverage beginning January 1st. You may also be eligible for an SEP, which may allow you to join, switch, or drop your Medicare plan. If you, for instance, permanently move out of your plan service area, if you lose other credible prescription drug coverage, also if you weren't adequately informed that your other coverage wasn't creditable or that the coverage was reduced so that it became no longer creditable. You may also have an SEP when you enter, live at, or leave an institution like a nursing home. There's an SEP for those who have or lose Medicaid as well. Beginning last year, if you have extra help, you no longer have a continuous SEP. It used to be before last year you could change plans as often as monthly for those with extra help. I probably would never have recommended that, but for beginning 2019, you can change plans once per quarter in the first 3 quarters of the year. You can switch to a Medicare Part D plan that has 5 stars for its overall star rating from December 8th through November 30th of each year. However, you can use this SEP once during this time frame only. Next slide, please. Choosing a Part D plan. You can use the Medicare Plan Finder, which is a really great resource on Medicare.gov. You can call 1-800-MEDICARE, or you can contact your state SHIP program for free counseling to help you compare Medicare drug plans or managed care plans. If you are doing the research yourself and not using any of those resources, once you find a plan that you feel meets your needs, you can call the company offering it and ask how to join. All plans must offer paper enrollment applications, and all plans may let you enroll through their website or over the phone. Plans are required to process applications in a timely manner. After you apply, they must notify you whether it's been accepted or denied, and they are not allowed to deny your application based on health conditions or the drugs you are taking. Next slide, please. Let's talk about Medicare Advantage plans, or Part C. MA plans, like an HMO or PPO, is another way to get your Medicare. MA plans are offered by Medicare-approved private companies that must follow CMS rules. If you join an MA plan, you still have Medicare. That's important, but you'll get your Medicare Part A and Part B from the MA plan and not original Medicare. In most cases, you'll need to use healthcare providers who participate in the plan's network. Some plans offer out-of-network coverage. If you choose an MA plan, your plan will give you a card to use when you get healthcare services, and your MA plan ID is your main card for Medicare instead of your actual Medicare card. Next slide, please. How do MA plans work? Again, you're still in Medicare with all the rights and protections. You will still get services covered by Part A and Part B, but the MA plan covers those services instead of original Medicare. You may choose an MA plan that includes prescription drug coverage, You can be charged different out-of-pocket costs. However, you can't be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing care. You can choose a plan that includes additional benefits like vision, dental. Some include fitness and wellness benefits. General, not covered. I was going to say generally, but not covered by Medicare. MA plans have a yearly limit on your out-of-pocket costs as well. Next slide. Continuing how MA plans work, each plan has a service area in which its enrollees must live. You or a provider can request to see if an item or services will be covered by the plan in advance. This is called an organization determination. Medicare pays a fixed amount for your coverage each month to the companies offering managed care plans. Each plan can have different rules for how you get services. And then finally, hospice care is covered if you're enrolled in an MA plan, but this is the only instance where the coverage is through original Medicare. So original Medicare covers the hospice benefits for the MA plan. Next slide, please. So how can you enroll in a Medicare plan or Medicare Advantage plan? You can enroll during your IEP for Medicare A and B. There is an MAOEP, which allows individuals enrolled in an MA plan to make a one-time election during the first 3 months of the calendar year. In addition, newly MA-eligible individuals can enroll in an MA plan to make that one-time election. This enrollment period, however, doesn't allow for Part D changes for individuals enrolled in original Medicare, including those with an enrollment in standalone PD. Next slide, please. When can you enroll? Continue. Again, during Medicare's open enrollment period, the October 15th through December 7th of each year, with coverage starting on January 1st. If you have Part A and enroll in Part B during the general enrollment period, you can enroll in an MA plan April 1st through June 30th with coverage starting July 1st, because remember, enrollment into Medicare during a GEP, the Part B starts July 1st. So if you're interested in a Medicare Advantage plan, you want to plan that enrollment to coincide with your July 1st Part B start date. You can enroll during an SEP, which would include those similar to the Part D enrollment, is if you move out of the plan service area, have or lose Medicaid or extra help. If you move into or out of an institution like a nursing home, you have a special enrollment. And then the 5-star SEP, where you can switch to an MA plan or Medicare cost plan that have 5 stars as its overall rating. Next slide, please. How do you enroll into a Medicare Advantage plan? Again, you can use the Medicare Plan Finder on Medicare.gov. You can visit the plan's website to see if you can join online. You can fill out the paper enrollment plan and contact the plan if they offer that option. Or you can call 1-800-Medicare. Not listed on this slide would also be a state health insurance program that could help with that enrollment. Next slide, please. Medicare in the marketplace, it's against the law for someone who knows that you have Medicare to sell you a marketplace plan. This is true even if you only have Part A or only Part B. The exception is a marketplace plan through your employer, sold through the Small Business Health Options Program called SHOP. If you're an active worker or a dependent of active worker, SHOP coverage may pay first before Medicare. If you delay enrollment because you have employer coverage through SHOP, you won't pay a late enrollment penalty if you enroll anytime you have SHOP marketplace coverage or within 8 months of losing that coverage. Next slide, please. Marketplace and becoming eligible. If you have coverage through an individual health insurance marketplace plan, not through an employer, you may want to terminate your marketplace coverage and enroll in Medicare during your IEP to avoid the risk of delay in future Medicare coverage and the possibility of a Medicare LEP. Once you're considered eligible for Part A, you won't qualify for help paying your marketplace plan premiums or other medical costs. If you continue to get help paying your marketplace plan premium after you have Medicare, you might have to pay back the help you got when you file your taxes. Next slide, please. Okay, if you're entitled to Social Security, disability, insurance benefits, you may qualify for Medicare again after that 24-month waiting period. In that 25th month, Medicare coverage can start. During this waiting period, of course, you can apply for coverage in Marketplace. Once you're eligible for Medicare, however, you won't be able to get the lower cost for the Marketplace plan based on your income. Once your Part A coverage starts, any premium tax credits and reduced cost sharing you may have qualified for the Marketplace will stop. And that is because Part A is considered minimal essential coverage. However, Part B is not. Also remember that Marketplace QHB isn't required to pay any cost towards your coverage once you have Medicare. Next slide, please. Choosing Marketplace coverage instead of Medicare, you can choose that if, in a few instances, if you're paying a Medicare Part A premium, you don't have that work history or the appropriate quarters of coverage, you can drop your Part A and B coverage and get a Marketplace plan instead. If you only have Part B and have to pay a premium, you can drop Part B and get a Marketplace plan. If you're eligible for Medicare because you haven't enrolled because you pay a Part A premium, you have a medical condition that qualifies you for Medicare, such as ESRD, but haven't applied, or if you're in your 24-month disability waiting period. 2 more points important to consider would be if you don't enroll into Medicare during an IEP, there could be a late enrollment penalty. And also that you could be subject to the general enrollment period, which could cause a gap in coverage for you. So those are considerations to take. Next slide, please. So we talked about, the costs and the coverage for A and B and for Part D. So let's go over really quickly, assistance with some of those Medicare costs as I talked about. There are programs available to help people with limited income and resources to help with the health and prescription drug costs. These include the Medicare Savings Program, Extra Help, and Medicaid. We recommend that people apply for these programs if they have limited income and resources. Even if they aren't sure they would qualify, we recommend you apply. The Medicare Savings Program provides help from your state paying Medicare costs, including premiums, deductibles, and co-insurance. It often has a higher income and resource guideline than full Medicaid. We would ask that they contact your state Medicaid office. Extra Help is a program that helps people with the cost of Medicare prescription drug coverage. It's also called low-income subsidies. Some people with Medicare must apply for Extra Help through Social Security or their state Medicaid office. And then there is Medicaid, which helps pay costs for those with limited income and resources. Medicaid is jointly funded by the federal and state governments and administered by each state. And of course, contact your state Medicaid office about applying. So the next slide is what the eligibility requirements are for the Medicare Savings Program in 2019. I'm not sure. I don't think 2020 eligibility income guidelines are out yet. I'm not exactly sure. But if you're looking at this chart, for instance, the qualified Medicare beneficiary, the individual income, monthly income is $1,061 for a single person or $1,430 for a couple. And what this does is pay your Part A, if you have one, and Part B premiums, and other cost sharings like deductibles, co-insurance, and co-payments for Medicare. And then, the other three programs under the Medicare Savings Program are below that. All four programs, at the very minimum, cover the Medicare Part B premium. Next slide, please. And what is Extra Help that we've been talking so much about, or low-income subsidy? This is a Medicare program to help people with limited income and resources pay Medicare Part D, or help pay Medicare Part D costs like premiums, deductibles, and co-insurance. If you have the lowest income and resources, you'll pay no premiums or deductibles and have small or no co-payments. If you have a slightly higher income and resources, you'll have a reduced deductible and pay a little more out of pocket. If you qualify for Extra Help, you won't have a coverage gap or Part D LEPs. Next slide, please. Qualifying for Extra Help. You automatically qualify for Extra Help and don't need to apply if you have Medicare and get full Medicaid coverage, sometimes called full duals. You automatically qualify if you're receiving SSI or you're getting help from Medicaid paying your Medicare Part B premiums under the Medicare Savings Program. Even if you don't meet any of those conditions, you may still qualify for Extra Help, but you'll need to apply. If you think you qualify but aren't sure, we, again, suggest that you apply. You can apply for Extra Help at any time, reapply anytime if you're denied, if your circumstances change. Eligibility for Extra Help may be determined by either Social Security or your state Medicaid office. You can apply at Social Security through their website. You can complete a paper application by calling Social Security for one. You can apply at your state Medicaid office or receive assistance in the application through your state health insurance program. Next slide, please. What is Medicaid? I think we're all familiar with what Medicaid is, and I believe we're going to be having another webinar specific to Medicaid. Of course, it's a joint federal and state program that helps pay health care costs if you have limited income and resources. Some people qualify for both Medicare and Medicaid. If you do, most of your health care costs are covered. If you have Medicare and or full Medicaid coverage, Medicare covers your Part D prescription drugs. Medicaid may still cover some drugs that Medicare doesn't. People with Medicaid may get coverage for services that Medicare may just cover partially, like nursing home care, personal care, and home and community-based services. But of course, you apply for Medicaid through your state Medicaid office. Next slide, please. And finally, just to wrap it up, I just wanted to provide some helpful websites. Of course, Medicare.gov, Medicaid.gov, Social Security, Health Insurance Marketplace, as listed on this slide. On the state health insurance programs, the SHIP, these are state agencies that help with Medicare issues, any Medicare issues, and there are volunteers in every state where you can get assistance with your Medicare questions. So I wanted to include that. And lastly, I want to thank you all for participating in this call. I really appreciate it. And now I am going to turn it over to Amanda Ree, ready for questions.
We will now move into the Q&A portion of the webinar. Our first question, can you get Medicare Advantage while employed? Mary?
Hi there. You can get a Medicare Advantage plan while employed. A couple things that I want to add to that is if you don't have current group health coverage through your employer, there's not an issue getting a Medicare Advantage plan. However, if you currently do have a group health coverage through your employer and are looking at a Medicare Advantage plan, you'll want to contact your employer to see how benefits may or may not coordinate with that plan, with a Medicare Advantage plan, I should say.
Thank you. Our next question is, if a client has received no benefits for 3 months and has to call to get their Medicare card, will there be late enrollment issues? Mary?
I am a little confused at this question, so I'm going to guess. I'm assuming the person has Medicare and has not received services for 3 months. So if someone is already enrolled into Medicare, even though they haven't used their benefits, there should not be late enrollment issues. But not having further clarification on that question, I guess that's the best I can do with that.
Thank you. If a client turned 65 in December and lost out on their IEP, Can they apply for Part A now, or do they have to wait until next January to enroll in Part B?
If the person turned 65 in December and they're outside their IEP and having no creditable coverage or employer group health plan coverage based on active employment, they can apply for Part A now. And depending on the circumstances, yes, they may have to wait until the general enrollment period next January through March 31st of next year to enroll into Part B. However, if they've had active coverage based on employment, they would not have to wait for enrollment into the Part B. And keep in mind that if they apply now for the Part A could go back retroactively to December 1st, the month of the client's 65th birthday.
Thank you. Our next question is, if an individual loses Medicaid, do they have to pay $144.60 even if they previously had a lower rate? Mary.
I don't believe so, but I would like to clarify, because I do know that if someone was having their premiums paid through the Medicare Savings Program or Medicaid, under those programs, they would pay the current Part B premium amount. I do know that some people who receive Social Security benefits pay the lesser amount, as you indicate, and this is due to the statutory hold harmless provision, which limits the increase in Part B premiums to be no more than the increase in their Social Security benefits. So I think once you lose that coverage, it reverts back to the hold harmless, but I would need to clarify that.
Thank you. Is Veteran Affairs coverage credible if someone is no longer eligible for VA benefits? Mary.
No, VA coverage is not considered credible coverage for the purposes of Medicare program.
Our next question is, are there programs that can pay the Medigap premium for low-income participants? Mary.
There are no programs that I'm aware of that can help pay that Medigap premium for low-income participants.
Thank you. What are some situations that can incur a penalty? Why would it make a difference if you join at 70 versus 90? Mary.
So for Medicare, you incur a late enrollment penalty if you didn't join, for instance, Part B, when you could have or should have enrolled. And I guess the difference in enrollment would be the amount of penalty you would pay, because the penalty for the Part B premium is 10% for each full 12 months that you delay enrollment into Medicare Part B when you could have or should have. So I guess the difference between enrolling at 70 or 90 would be the amount of penalty you would incur, like potentially a 50% penalty for each of the 5 years past age 65 for someone who's 70, versus a 250% penalty to a Part B premium for waiting until you're 90.
Thank you. Our next question is, How does a client find out whether they have paid in enough to avoid a premium? Mary.
So on this question, I'm assuming you're talking about Medicare Part A and appropriate quarters of coverage to qualify for Medicare premium-free Part A. You would find out if someone is eligible for Medicare premium-free Part A by contacting the Social Security Administration.
Thank you. Our next question is, where can we find the paper form to enroll in Part D? Mary.
So there isn't a standardized form to sign up for or enroll into a Medicare Part D plan. Again, you can work with 1-800-MEDICARE or the plan directly or your state health insurance assistance program to enroll in a plan. Each Part D plan has their own applications for enrollment.
Thank you. Our next question is, are enrolled Native Americans that have MC/SLMB benefits liable for Medicaid cost shares? Cindy.
Thank you. So individuals that are enrolled in the specified low-income Medicare beneficiaries or SLMB program through the Medicaid agency receive a benefit of their Medicare premium. There is no benefit to cover the Medicare cost-sharing, coinsurance, and deductibles, which is what I think they mean by this question. If a person has SLMB, they're not Medicaid eligible, so there's no Medicaid cost sharing. And again, the SLMB benefit only pays for the premium for Medicare Part B. Thanks.
Thank you. Our next question is, are Medicare outpatients per visit rate increased from $150 to $427? Now that we know our Federal Register rate, can we increase our billed amount to $427, or does a cost reporting prevent this? Kitty.
Thank you. This is Kitty Marks, the Director of the Division of Tribal Affairs, and I think we might need more information regarding this question. The Medicare outpatient rate per the calendar year 2020 Federal Register is $427, but that rate applies to Medicare provider-based clinics that are affiliated with a hospital. They can bill at the $427 Medicare outpatient rate. If you're a tribal program that might be enrolled in Medicare as an FQHC, you have a prospective payment system rate, which is much lower than the $427, or as a tribal program, you can bill at the physician fee schedule rate. So I'm not sure what is meant by this question, so if you'd like more follow-up, please send the question to tribalaffairs@cms.hhs.gov. And again, that's tribalaffairs, all one word, @cms.hhs.gov, and we'll look for that question and follow up with you individually. Thank you.
Thank you. Finally, our next and last question. We are interested in starting a Medicare wraparound program for FQHCs for Medicare Advantage plans. According to Section 206, some providers do not need contracts to be reimbursed. How would they enroll in the wraparound program without contracts? And how can they get Medicare Advantage plans to pay out without contracts? Kitty.
Okay, thank you. We know that there is an issue with some Medicare Advantage plans not reimbursing IHS and tribal programs when they do not have a contract in place. This is a Medicare policy issue that the Division of Tribal Affairs is working on. But currently, the remedy is for these providers to file a claim under Section 206 as a right of recovery against the Medicare Advantage plans. That's the option right now for those IHS and tribal programs. I am not familiar with a Medicare wraparound program for FQHCs for Medicare Advantage plans. There is a wraparound program for FQHCs participating in Medicaid, and that is in statute. So I think that's the best answer I can give you is right now, IHS and tribal programs have a right of recovery under Section 206 of the Indian Healthcare Improvement Act. And again, like the previous question, if you want to send the question to tribalaffairs@cms.hhs.gov, we can follow up with you individually. Thank you.
Again, thank you, ladies, for participating in our Q&A session. I wanted to thank everybody again for attending our webinar. In closing, I would like to remind everyone to register for the remaining ITU webinars. The next webinar is scheduled Medicaid 101 on May 14th at 2 p.m. Eastern Time.